Hi everyone, today we are covering diabetic ketoacidosis. Now, this is a serious health condition that can happen as a result of diabetes. So, there's some patient who already has diabetes mellitus type 1. In them, it's quite evident that you will see diabetic ketoacidosis, especially in the initial stages when they've not already detected that they have diabetes and they're not taking the precautionary measures. In them, especially, you'll notice diabetic ketoacidosis. This is a medical emergency because in this condition, what happens is that, for example, a person has diabetes. That means his body, especially type 1 diabetes, his body is not making insulin. When insulin is not there, the body cells are unable to take up glucose. Body cells are unable to take up glucose. This sends a false signal to the body that there is insufficient glucose, even though that's not actually the case. There is enough of glucose present in the bloodstream, but the body cells are not able to take up all of that glucose because insulin is not present, and insulin is super important in order to uptake the glucose into the cells. Because of this, the body starts breaking down a lot of things. For example, glycogen starts breaking down in order to produce more glucose. Gluconeogenesis starts happening in order to produce glucose. So your entire body starts working towards producing glucose, right? So now you have way more glucose. That's the reason blood sugar levels are so high in diabetes. This is what I explained as diabetes. But uncontrolled diabetes, it leads to diabetic ketoacidosis because already so much glucose is being made. But other than that, even fatty acid oxidation is happening. So fatty acids are also being broken down for energy, and then they produce acetyl CoA. That acetyl CoA that gets converted to ketone bodies. You have acetoacetate, beta hydroxybutyrate, and acetone as your ketone bodies. So the body has a lot of ketone bodies now, and they all start accumulating in blood. They cannot be used because obviously the body has produced so much in abundance that the body is unable to keep up and use all of that ketones or ketone bodies. So diabetic ketoacidosis develops when the body can make enough insulin. Insulin plays a key role in helping blood sugar, also called glucose, enter the cells in the body. Glucose is a major source of energy for muscles and other tissues. Without enough insulin, the body begins to break down fat as a fuel. This causes a buildup of acids in the blood. Those acids are called ketones. If not treated, the buildup can lead to diabetic ketoacidosis. So usually the people who have diabetes, they're very at risk of this disease. And what are the symptoms? One of the symptoms is being very thirsty, urinating often. So basically, I'll explain these first. So person is usually very thirsty when they're dehydrated, and they're urinating very often when they're taking in a lot of water, they're drinking a lot of water. So basically what happens, your kidneys start working towards removing that excess ketone bodies and that excess glucose from your body, right? So that is happening where the kidneys and urination. So there is frequent urination, polyuria, and there is frequent thirst because obviously the body keeps on dehydrating. So you need, in order to combat that, you need to drink water regularly. So polydipsia, there is frequent thirst. And then the person feels very nauseous, and they have abdominal pain. They feel very tired and fatigued. They're breathless usually, and this also you can see cause more breathing in them because they're breathless. They have a fruity scented breath because of the acetone, and they are very confused because the brain isn't getting the required energy. So what's the test? You can buy a urine test kit, which is a bedside test, and in that you'll see high ketone levels in urine. And other than that, there's also a blood test that will show high blood sugar levels. And yes, these are the conditions when you need to see the doctor. And then the causes of ketoacidosis is not having enough insulin in the body. Without enough insulin, the body can't use the sugar in your body. So without enough insulin, the body releases the hormones that break down fat, and this makes a lot of ketone bodies. And it's not necessary that diabetic ketoacidosis they need to have, yeah, they do have in patients. This usually occurs in patients that have diabetes mellitus type 1, but usually only in the conditions when either they forget taking their insulin injection. So a problem with the insulin therapy, miss insulin treatments, this can result in too little insulin in the body, and that can lead to DKA or an illness such as infections or other illnesses, especially pneumonia. Because these all infections, they can also cause diabetic ketoacidosis because these increase the level of hormones such as adrenaline, cortisol, and other hormones as well. Epinephrine, that's adrenaline, right? And then you have uh yes, so it's normally said not to give a lot of stress to a diabetic patient. So in that condition also, and especially alcohol or drug misuse. This is very important. Alcohol consumption can also lead to DKA. And these are the complications: hypoketotic hypoglycemia, or hypoketotic hypoglycemia. That's one thing. That low blood sugar and low ketone levels, and also hypokalemia. Why is there low potassium? Because in order to treat the fluids and insulin used to treat diabetic ketoacidosis can cause body's potassium level to drop too low. A low potassium level can affect the heart muscles and nerves. To keep this from happening, potassium and other minerals most often are given with the fluid replacement as a part of the treatment. And even cerebral edema can occur because as the blood sugar levels they drop or they rise very quickly, tends to take place. And these are the prevention. The sole prevention is to manage the diabetes, to take insulin regularly, and to monitor the sugar level, to monitor the ketone level. So these are the sole things that you need to take care of. Now moving on. Again, let's come to diabetic ketoacidosis. Here, this will help you understand it in a better fashion. So you can see that first of all, insulin is not there, glucose is unable to be processed by the body. Then what happens? The liver produces more glucose to feed the body without insulin, but to feed the body, right? So the liver is going to think, okay, wait, maybe there's no insulin, no glucose. That's the reason we're not getting energy. So it'll start producing more insulin, more glucose. Sorry, more glucose. And how does it do that? So this is happening in liver. It breaks glycogen, glycogenolysis happens, and glucose is produced. It uses protein lipids, and gluconeogenesis happens, and it produces glucose. So liver is constantly trying to produce glucose. It doesn't understand that that insulin is creating the problem. And then what happens that the body needs to find an alternative source of energy and starts breaking down fat. But with the glucose, nothing is happening. So body is trying to use an alternative fuel, which is fat. And fat breakdown produces acetyl-CoA and then ketones, which builds up in bloodstream. Ketones and glucose are transferred into urine. The kidneys use water to clear the body from excess glucose and ketones. So frequent polydipsia, polyuria, and dehydration. So polydipsia, frequent thirst. Polyuria, frequent urination, and dehydration is happening. Bladder. While the body attempts to get rid of the ketones and glucose, a lot of water is lost. This can lead to dehydration and may worsen ketoacidosis. And these are the hormones that I was talking about. And also fatty acids can break down urea, and then you get the ketone bodies. These are the ketone bodies. Acetone gives you the sweet breath. Metabolic acidosis is happening because of hydroxybutyrate and acetoacetate. That leads to metabolic acidosis, and in order to combat that, there's like frequent breathing, called small breathing, and potassium disturbances are also there. And osmotic diuresis, frequent osmotic diuresis leads to polyuria, polydipsia, and dehydration. And you can look at these symptoms. This is called small breathing, fruity smell, confusion, irritability, excessive thirst, and you can see persistent need to urinate and increased appetite, and nausea and vomiting. Diabetic ketoacidosis, hyperglycemia is there. Metabolic, I think I said hypoglycemia somewhere. But anyways, it has hyperglycemia, metabolic acidosis, glucosuria, ketonuria, ketonemia. And yes, these are the risk factors: illness, infection, then inadequate insulin administration, and trauma and injury. So, in simple words, let's see what diabetic ketoacidosis is. What is the difference between ketones in diabetes and diabetic ketoacidosis? When ketones are there in diabetes, that's normal or mild ketonemia, because body is even normally producing ketone bodies, even in normal conditions. But during fasting, low carb diets, mild insulin deficiency, or early diabetes, ketones are being made, but they're not dangerously high, okay, when a person is fasting. But this gets uncontrolled, and DK is a very dangerous condition, and it gets uncontrolled when the person is fasting for a very long time, or he is exercising vigorously for a very long time. So then there is massive breakdown of skyrocket of the fat. So basically, fat breakdown skyrockets, and everything happens, right? And then the second thing, this is the link between diabetes and ketones. Insulin is low in type 1 diabetes. Liver does massive detoxification. TC cycle slows down. You know why it slows down now? Excess acetyl-CoA ketone bodies are acidic. So this. So if you want to explain it to someone, just explaining the entire mechanism, that would be enough. Or if you want to just say it in a word or two, or in a sentence or two, you can say it is a type of metabolic acidosis. What is it? It's a type of metabolic acidosis metabolic acidosis that uh, is caused by imbalance between ketone body production and use, and this occurs in especially those patients who are newly diagnosed with T1D type 1 diabetes, and may reoccur if the patient becomes ill, most commonly with an infection or does not comply with therapy. So this is basically a metabolic acidosis condition which is caused by an imbalance between the ketone body production and its usage. And also, what's the treatment? Its treatment is administering short-acting insulin, correcting the hyperglycemia, and also by replacing the fluid. So you need to replace the fluid. IV is given. So that's about DKA.